Okay. Welcome everyone to Database 101. I am Amanda Holcomb. I'm the 211 Virginia Community Engagement Manager. And then for those in the Southwest region, I'm also your Community Engagement representative. And you're going to learn a little bit more about our team today and your connections too if you don't already have them, but we'll go ahead and dive in. We're going to ask you to put your questions, any questions that you have in the chat. This is we're going to go back and forth between our slide set and then also the actual back end of our database listing, just so you can see what you're going to see when you're updating and getting listed and all of those good things. Okay. So this week is 211 Virginia week. Hopefully you've been able to join us throughout the week, but today we have our Database 101. And then tomorrow we have our Beyond the Listing. It's at 2:11 p.m., just like this one, where we're going to talk a little bit more about how you can get a little bit farther involved than just having a listing with 211 Virginia. We're going to introduce our Anchor Agency program and then solicit some input from you for our resources. And then we'll wrap up on Friday at 10 a.m. with a Beyond the Numbers session where we're going to look at impact and needs data by region. We'll look at our planning districts, some of our gaps in services, and just some overall impact data throughout the year. And then Saturday, the reason this whole week is happening is leading up to 211 Day, and we invite you to share on your social media pages, just some general awareness about 211 and celebrate kind of this free information and referral service that we have in Virginia. This link right here is active, and so is this button if you want to click that for registration for these two sessions. So we're all here today for Database 101. I think it's important to note I'm a community engagement manager, and we do have a team of database curators and people who are kind of in the database 401 session. So this is going to be definitely an introduction course. And so if I don't have the answer, I will certainly get you in touch with our database team as well. So today we're going to focus on how to get listed, get updated, and get the most out of your 211 Virginia listing. As an overview of today's session, I don't know if we'll be here that full 2 hours. We generally aren't, depending on how many questions that we have, but this is pretty in-depth on getting listed. So first, we'll talk a little bit about 211 Virginia. If you're here, you probably are familiar with us. How to get started. We'll look at our inclusion and exclusion criteria. So basically, who is eligible to be in our database and who is not, who we would like to recruit for our database, and who does kind of not meet that criteria. We'll look at that. And then we'll go into more of the demos and getting listed. Then we'll refer back to that with getting updated. And then we'll close with getting connected and just how to get in touch with your community engagement team and our database teams. Oh, and I put this here to remind myself. So if I don't do a demo, just say, hey, I think there was supposed to be a demo here on certain slides so I can close out of this and bring up our the database. And maybe Mary, you can give me a shout if that happens. All right. So a little bit about 211 Virginia. We are the easy to remember 3-digit dialing code connecting people with information on available community services throughout the Commonwealth. We have highly trained community resource specialists who utilize a statewide web-based database with over 17,000 listings. So you'll hear listings a lot today. So this is our program listings, not the 17,000 agencies. And as always, 211 is free, it's confidential, it's available 24/7, 365. We literally never close. We are open. All the holidays, evenings, after hours, we are available. And 211 Virginia is available not only by phone by dialing 211, we're also available by text That's 247-211, a live chat, email, and a searchable database on 211virginia.org. So a little bit about 211. We are a contracted public-private partnership between the Virginia Department of Social Services and the Council of Community Services, and we offer this service in collaboration with our United Way of Central Virginia. So we are primarily funded with our contract with the Virginia Department of Social Services, and then the Council of Community Services administers the service in collaboration with our United Way. And so our United Way of Central Virginia is really where our database is housed, as well as our database team members. So 211 was established, or not 211, information referral. So the system, the service, was established in the Code of Virginia in 1984. And then in 2006, Virginia officially became a 211. So for 211 Day, it's important to note that we're celebrating our 17th year of having a 211 Virginia in the state of Virginia. And so 211 is a source for referrals to government, nonprofit, and faith-based agencies, and many more. So some of the benefits of 211 Virginia, and this includes just a benefit of the service to Virginians, but then also a benefit to our service providers and those that are listed in our database. And so 211 Virginia acts as a central access point to Virginia's health and human service agencies. We maintain an extensive resource database, which I've already mentioned, of over 6,000 agencies and 17,000 programs across the Commonwealth. By existing, we field the first call, and we can help reduce the burden of service on service providers. So while you are trying to work directly with your clients, you may need other support services and not know who to turn to, or also have the time to really sit down with someone and navigate this huge health and human services field that we have. So a good thing to have is 211 Virginia. We pre-screen and we strive only to refer individuals who meet your agency's eligibility criteria or requirements. You'll see that we have kind of an extensive offering of your program listing, and we do that so we give the best referrals to those people who are in need. And we like to think that 211 saves time, and it's a resource, of course, for agency staff. It's free, it's 24/7, and is available for social workers, hospital staff, government officials, law enforcement, and really everyone. 211 is available for everyone. I think it's important to note that, especially when we think about our social workers in the hospital setting, our doctors, our nurses, and those support staff and government officials and law enforcement who are going to interact with people in crisis and may not know where to turn them. Or they might have 2 or 3 agencies in your communities that they constantly refer to, and that might not be the appropriate referral. So for them to have 211 as a resource so they can connect to appropriate referrals is a major benefit for our communities. So that's a little bit about 211 and our benefits of 211. So we're going to get started, and we're going to look at our database inclusion and exclusion criteria. And it's important to note that we follow standard guidelines set forth by the Alliance of Information and Referral Systems in determining what listings to include in our database. So the Alliance of Information and Referral Systems is really, I'm going to let people in again, sorry, is really the gold standard and best practice when it comes to information and referral. And that is who we look to for a lot of our standards when it comes to our database and just how we deliver the 211 Virginia service. There's accreditations, along with that, certifications that our team members have. So it's really just a gold standard when it comes to information and referral. So before you get started, we ask you to read the inclusion and exclusion policy before entering any of your program information into the database. You can find that information by going to 211virginia.org And then at the top, which you'll see in a little bit, scrolls to a menu, and then the top right corner is going to say update, add your agency. You're going to go there, and then you'll see click here to view 211 Virginia's inclusion and exclusion criteria. And then that is going to open up a 2-page, I believe, PDF that you can read at your own leisure. But today we are going to take a closer look into the inclusion and exclusion. So this is who is included in our criteria and who is eligible to become a listed agency in our database. So we ask that the agency and service provider must provide a human service. So the definition of a human service is listed in our policy, but it's basically anyone who provides an essential service or a social connection or support to people to enhance their quality of life. So that is a very kind of broad definition, but that is a main requirement of being included in our database. The agency service provider must serve the residents of Virginia because we are 211 Virginia. There are other 211s actually across the entire country, Puerto Rico and Canada. So they have an opportunity to list them there, but our criteria makes them have to serve residents of Virginia. The agency or service provider must have existed for more than 6 months to indicate a degree of permanence. We know that when you're getting started, you might not have a contact, you might not even be offering any services yet to our community, and you're really getting up and running. You might have a location change or something like that. So within 6 months of getting issued your kind of status, you're eligible for here. And there are exceptions with that. An agency and service provider may be either government, faith-based, or nonprofit. For-profit organizations and unincorporated groups that meet critical human service needs shall be included. And then an agency or service provider, when we add them, we do take priority for those that are scarce. So there's not a lot of other agencies that provide that. They have free or low-cost resources. So here are just some examples of inclusion. It's kind of everything that you can think of when it comes to human services, but local agencies providing information and referral, including specialized information and referral. So we're going to have, we can have hotlines and crisis lines. We can have, I know some of your communities have their own kind of information and referral that directly just have their community resources. Things like that can be included. We have specialized information and referral, like our child care aware programs and infant toddler connections. So there are some other information and referrals that can be included in our information and referral. Essential services, kind of when you think of human services, this is probably going to be your first come to mind. Those that provide basic kind of needs, our food, our shelter, our clothing, our transportation services are definitely an example of inclusion. Government agencies, so you can be local, state, and federal as long as you're serving residents of Virginia, you can be included. And then agencies located in bordering states, as long as they serve residents of Virginia. So we have our friends in DC, we have our friends in Maryland, West Virginia, Tennessee, and even North Carolina that do kind of borderline that are eligible to be included. One that I have in far Southwest is like our Haven, and they actually serve Bristol, Tennessee, and Bristol, Virginia. So they would probably be included in both of our 211s. Advocacy organizations can be included. Self-help support groups. We can track state, regional, or national headquarters instead of local groups. So again, when you think of like, as an example, like your local AA or NA support groups, it might make more sense for us to have the statewide resource that we can refer to that has the local resources, then include every single self-help kind of group. A lot of times that information changes, their locations change, their contact person changes. So we really do kind of take that on a case-by-case basis. State and national parks located in Virginia. A lot of people might not think about human services, but recreation, arts and culture, things like that can also be included in our database. For-profit agencies that provide health and human services, either free or on a sliding fee basis, can be included. Private for-profit and mental health care group practices also can be included. And then childcare preschool programs that are either Virginia quality, affiliated with Smart Beginnings or NAEYC accredited, and also Head Start programs can be included in our database. So that's a lot that can be included. So we'll look now at those agencies that cannot be included. So organizations that discriminate based on race, religion, or similar factors. And I think it's important to note the difference of having a program that is offering directly to a population versus discrimination, because an LGBT center, someone like in my region, we have our Black Father Family Initiative, a lot of religious-based organizations that exist to serve those populations. That is not discrimination. So there's definitely a difference between that and what is discrimination. It's a refusal of service. Organizations engaged in fraudulent or illegal activities, we do not want them included in our database, and I'm sure you do not want your clients going there either. Agencies which misrepresent their services in any way, including a non-delivering of service. So as part of being listed in our database, we do have at least an annual update. If we can't get in contact with you for up to like 3 tries, we might have to look if you're doing a non-delivery of service. And so that could disqualify you from being in our database or having to delist or just kind of work with you a little more. There were some things during COVID where we didn't have delivery of services, and that was an exception because we were in an exceptional time. So some of this is definitely on a case-by-case basis, but this is really that you are existing and providing the services that you say you are. So while we let groups in, we do not allow individual practitioners to list with 211 Virginia. So physicians and psychiatrists in a private practice are not eligible. We aren't at rateyourdoctors.com. We can't endorse certain ones either. There's no way to vet those type of services, and those just aren't appropriate listings for 211 Virginia. Organizations are professionals who are not licensed and where in areas where licensure exists, they are not eligible. Of course, no one wants to send someone to someone for medical or mental health services or even school things where they're not actually licensed. And that kind of goes along with the fraudulent and illegal activities too. So those are not eligible. And then while we allow advocacy organizations, we do not allow political and issue-oriented groups unless the alternate viewpoint is also represented. So as an example, pro-choice versus pro-life or pro-gun versus anti-gun control. And a little bit more about who is not eligible for our database. Faith community-based programs that only serve their own congregations. It wouldn't make sense for them to be in 211 Virginia because we really have no way to screen out who is part of a congregation or who isn't part of a congregation. And that's such a small pool that it wouldn't make sense for them to be listed in 211 Virginia. Organizations that provide only funding for programs but no direct services are not eligible to be in 211 Virginia. And along the similar lines, national organizations which local chapters directly administer services, we would probably have the local chapter unless that national service also offers services to Virginia. I think of like a Family Promise, the homeless congregation nonprofit. They're a national service, but we're going to have their local affiliations listed in our database because the national service is doing awareness and funding these programs, but they're not offering the service. And then along the same lines around the faith-based that only serve their own congregation, Organizations that exist solely to serve the clients of another service provider are not eligible to be in the 211 database. So as an example, a counseling service that exists only for a Department of Social Services Child Protective Services program, if that counseling service only does CPS clients, no one else, there's no way for us to refer to them. So we would just list, indicate in their listing that they have counseling services through this program as long as you're a client. So that is a little bit about the inclusion exclusion policy. You can read the 2-page document, but that really does give you the overview of it. If you have, I don't think we have any questions yet around this, so we will move on to while we're here, and that's how to get listed. So to get listed, you're going to follow that same kind of process, how we just found that inclusion exclusion policy. You're going to go to 211virginia.org, and then you're going to go update/add your agency. And then you're going to see this page right here. And so before adding your agency to the 211 Virginia database, we want you to double check that it does not already exist in our database. We know that sometimes staff might turn over, or you might have it listed in a different way than maybe you're thinking. So we really want you to look at, you can look at the searchable side, but you can also search here on this page. For example, we're going to get into the difference between an agency and a program listing, but I think about my agency, the Council of Community Services, and we wouldn't have necessarily our drop-in center as an agency because it's a program of the Council of Community Services. So when you're thinking about listing, we'll get into that, but just think about what maybe the very top agency would be that you're going to list. So you're going to go add new agency. And then once you push add new agency, it's going to show you this screen. And you're going to type in the name of your agency and the zip code. And so again, this is your agency name. So mine would be Council of Community Services, and then the zip code. So the zip code is going to be where your headquarters physically exists for your agency listing. So in my case, it would be 24016, and then you're going to hit submit. So you're going to again check to see if your agency is currently in our database. If your agency appears, it will appear right here. You'll click that link and then you'll go to that to update your agency. Otherwise, if your agency is not found, and it will say agency not found, you're going to click the add new button. So there will be some kind of double layered protection before it will let you get in when it comes to searching. So once you do this, you'll be on your administrative listing agency information page. And the agency information page, I'll show you later, but it doesn't look like this, but these are the contents that are in it. And that includes your agency name, which is going to be pre-filled from what you just searched. So that's going to be pre-filled in there. And then your physical and your mailing addresses. So this is just for your agency listing. It's just your agency information, not your program information. And so that's going to be your physical address. And then if you have a mailing address. So in my case, we have a PO box. So I would put our physical address, and I'd also add our PO box. For phone numbers, it's going to be a drop down that you can enter multiple phone numbers. But in this case, I think we have our main phone number and a fax, for example, for my organization. And then your website is going to be your main website, because again, we're doing agency information. And then for your contact, you are going to do your agency information, executive director title. So a lot of times that will be executive director. It could be CEO. It could be director is what you're going to put here. And then you're going to put that person's full name, their email address, and their phone number. And this is important to have updated and accurate, as we are going to send from our database communications with the administrative contact. And then you're going to go down to agency description, and we're asking for a brief narrative that describes your agency. This could be your mission statement, but a lot of times our mission statements they should say what we do, but a lot of times they don't. And so we also want to avoid jargon and technical information. So right here, you're really going to describe what your agency does, not your programs. You'll have a separate listing for your programs, but your agency. And then for business type, it's going to be a drop-down menu that you select your business type. We'll look at that, but it is pretty obvious. A lot of them are private, nonprofit, but there's government, there's other kind of options that you can fill in. And then keeping in mind with your agency administrative hours, you're going to select your days. So it's Sunday through Saturday, and then your opening and your closing time. So what time your agency opens and what time your agency closes. And if your programs are different, that's okay, because they get separate listings with your agency. And then you'll have an option to add additional comments or agency administrative hours on your agency administrative hours. So for an example, if on the second Tuesdays of the month, you're closed for staff training, you would note, closed second Tuesdays of the month. If you close for lunch from 1 to 2 every day, you can note that in those comment sections. So just additional comments. Then whenever you see this, you just stop and read it. So again, the agency information screen differs from areas to add your program and service specific information. And this information only pertains to your overall agency. So then when you're finished, you'll scroll to the bottom and you'll select save. So I am going to show you, let me stop screen, what that looks like on our side of things. And again, if you have any questions, feel free to enter them in the chat. Okay, so I'm on the Council of Community Services page. And when you are entering, none of this is going to be filled out, but here is everything that we just talked about. So you have our agency name, our agency address, our mailing address, our phone and our fax, and our website, and then our agency information for our executive director. And our agency description, you can see it's brief. And then right here, you'll see the drop down for business type. And you can see the screen, right? That I'm showing you right now. Mary, can you give me a thumbs up?
Yeah, it's coming through. Okay. You may want to zoom in on the screen a little bit and just change the view, but okay. It's definitely seeable.
Does that help at all?
Yeah, that does.
Okay, sorry.
Perfect.
The Zoom controls are so outrageous. I'm on 2 screens and it's a lot. So I'm always like, are you guys seeing it? Okay, so for business type, this is where I was talking about. Your drop down will be pretty obvious to what goes to you. In most cases, we have a lot of private nonprofits, but you'll see where there's an option for city and county administered, faith-based, federally administered, other state, town administered, and then we are private. Try not to touch anything with our listings. And then you'll see right here on the administrative agency hours, we have Monday through Friday checked with the 8:15 to 4:30. And we don't have any additional comments on that. And so that is where your agency information is. So we'll switch back over to our slides. Okay. Are we back on the slides?
Yes.
Okay. So once you're done, because you have a new listing, you're not already going to be in there. So we're going to need you to verify who you are and that you are an authorized person to update your listing. And so this is going to automatically pop up once you've just filled out all that agency information. This is going to automatically pop up, and you're going to be prompted to enter an email address. Retype your email address, your name, your title, your phone number, and then verify that you are an authorized person to update the service on behalf of the agency, just with a simple check. You'll also have an option to create a user account. So right here is where you can create your user ID and then your password. And then we always have to tell the machine that we're not a machine. So check I am not a robot and then submit. Otherwise, to re-enter back into your account or to do your updates, you're going to have to do this verification every time, or you can simply just have your user ID and password. And we'll talk about that in the update section. Okay, so for the AERS database standards, which we talked about, they require that each agency has a searchable database listing for administration. Now, it's important to note that our database software predates that requirement. So as a kind of a workaround, we have your administrative information just has to be re-entered as a program listing. And so it will be good practice for when you add your other services in there as well. So on that page that we were just on, after you do your agency information, this is going to be at the bottom, and you're going to click Add New Listing. And then from there, that information will pop up. So what you just did with your agency information does not suffice to being listed in our database. 211 Virginia refers to a program of an agency, not to the agency. So the agency is the parent record for all other records. And each administrative listing must have at least one program added that we can refer to. So now we're getting into your program listing, and we're going to complete that portion of it. And so this is what that page is going to look like once you hit that add your listing. And so these are all your different sections that you're going to fill out next in relation to your program. And you're going to click, it's pretty self-explanatory, but you're going to click the positives to expand, the edits to edit, and then once you're done, you're going to save each section, and then you can save and complete once you're done. Now, when you're updating, so this is all the same processes for when you're updating. But when you're updating, so if this wasn't a new listing, you would see a review, no changes. So if you're doing your annual update, or you're just curious and want to make sure you're still updated, you're just going to do review, no changes. And this is going to let us know that you've reviewed it and your listing is current. If you get in there and you think you messed something up and you're like, oh no, I didn't want to make that change, just hit cancel, and everything that you did won't be saved. And it's important to note that we have over 17,000 program listings. We are a statewide service, so it does take 2 to 4 weeks for anything that you're putting, adding new programs, changing information. It can take up to 2 to 4 weeks before you see that change. So just note that. Okay, so now you'll see where we just had that information, our listing name and contact information. So you'll see our main address, you'll see our location description, and you'll see our mailing address in that location description, our phone, our fax, our website, and that administrative contact. So you'll see everything that we just did. So then when you get into your program listing, this is the first section, is the who are we. So this is a description of your services offered through the individual program. It should also be clear and concise. You have to think about when this is on either the searchable database side of things or our community resource specialists are looking at it, they're not going to be able to scroll through like a big old narrative. So we just want things to be concise and clear as possible. We recommend one service per program listing, even for small agencies. And I'll give an example too, where even if you have one service or one program, you still might want to break it down into multiple listings. The keywords used to search on both the internal and public website are determined from this narrative. So once you write this narrative, you submit your listing, our database curators are going to look at that, and then they're going to associate the keywords that will then become the searchable kind of words that the database will pick up on. So having multiple programs in one listing are going to make it difficult and may result in incorrect referrals. And as always, I know it's really hard, but avoiding jargon and technical information. One of the examples I have within the Council of Community Services is that we have housing programs, and our Community Housing Resource Center could not just be one program listing because not everyone is eligible for every single service that's offered. So instead, we have that split up in threes. We have our prevention services, we have our homeless services like rapid rehousing, and then we have a specialized listing for our HOCWA program. So that's for housing opportunities for people with HIV or AIDS. So even though that might seem like one program listing, that actually became three. So you really want to think about who's accessing it, put yourself in the shoes of either someone on your searchable database side of things, or someone who is at our community, like our community resource specialist, and how they're going to search, and think about that kind of brain behind our database too, and how that might pull searches as well when you think about your program listings. So this is just an example of another program at the council, which is 211 Virginia, in our listing and our Who Are We. So we said 211 Virginia collects and maintains and disseminates information regarding health and human services related resources, provides data to assist in community planning efforts and service delivery upon request, offers services to the hearing impaired through Virginia Relay, bilingual Spanish representatives available during most peak hours, and third-party language translation available 24/7. So the next section for your program listing is going to be who do we serve? And so for who do you serve, this is going to be a select all that apply. And it's going to ask you where the service is provided. So you're going to think about your program and how you deliver that service. Is it in the consumer's home? Is it in the community? Is it on site? Is it telephone? Is it virtual? Or is it website? And again, that can be a check all that applies. Then we're going to go into service area. And so your service area is going to be add all that applies. And I'll show you this on our back end too. But basically, you're going to have a list on one side of all of the counties, independent cities, statewide, and national programs. And you're going to select where your agency service area is. So it could look very different. And that's another way to consider when you're thinking about how you want to split up your program listings and your service offerings. For example, with our housing, we may have one that only serves maybe the Roanoke Valley. So that's like 5 different entities within like the counties and cities. But then we might have one like our HOCWA program that is all of Southwest Virginia. So we know that listing is going to pull a whole lot more. But then if your listing is available for everyone in the state or anyone, then you might choose statewide or national. And again, that's a add all that apply. And then for age range, if you don't have any age range, you can just leave that field blank, and that means your program's available to anyone. But if you do have an age range, you are to include the minimum age if it's applicable, and then the maximum age if it's applicable. If there's no max age, If it's, 100 plus, then just leave that blank. A good example is like our after school programs. Is that like a 8 to 17 or a senior program? Is that like a minimum age of 50 or 55? So that's kind of an example of where age range does matter in some of our listings. And then for language, you're going to select all that apply. And this is the languages that your program can serve as far as what your staff speaks, and you'll see it in our listing. So in 211 Virginia's case, we may say we speak English, we speak Spanish, and then we have a comment around, like you saw in our what we do, where we do reference our language line. But we do not have the ability to offer those services through a staff member. And then for accommodations, you're going to select all that apply. And these are your choices for that. And a lot of times that is if your service can accommodate individuals who have any of these things, or sometimes it's if your service is directly targeted at serving these certain populations. Or let's see, like our HOPLA one would obviously be HIV and AIDS. Someone that maybe does mental health would probably do mental health problems. If you're a substance use agency, you would probably check that one. So you can kind of see where it would apply to you. And there's always a box to comment other eligibility and listing details as well. And then this is the select all that apply with documents required. So these are all your options for that: proof of residency, age, income, citizenship, family size, your birth certificate, eviction notices, photo IDs, cutoff notices. So we definitely use those more for like our housing, our utility, our financial assistance, but it's always good to be as thorough as possible so we can give that best referral. And so whoever's seeking your services kind of knows what to expect as well. So this is what the program listing, who do we serve, looks like once you've completed that information. So you can see this is a pretty 1, 2, 3, 4, 5, 6 that we chose, and you can see how many it asks for. So you can really leave things blank if it's not applicable to your program. But we do ask that you're concise, you're clear, and you're thorough when you do think about your listing. So on this one, I believe this is probably for one of our drop-in center programs at the Council of Community Services, but where the service is provided, it's on site. The age range is 13 and above. Among our staff, we can speak English. Our program is able to accommodate HIV, AIDS, and wheelchair. Our service area, you can see this is most of Southwest Virginia, if not all of Southwest Virginia, and then other eligibility requirements. So we just noted that general public with the focus on those most at risk for HIV and AIDS or hepatitis C. So next, I don't think I have a slide other than just showing you this because the service cost is pretty straightforward. Most of our listings are going to be no fee with the exception of those that maybe have a sliding scale or a fixed range or a fee range or based on your income. So you can see where this is really personalized, that you can check which ones apply. And then if you do have some type of fee, that you can check here if no one's going to be denied for inability to pay. Now, if people will be denied for inability to pay, then we ask you to be specific what the fee and cost of service is. And of course, there's a spot for additional comments. And then once we get in kind of insurance and our Medicaid and Medicare programs, private pay, Veterans Administration, you can check any funding sources down here if your program has those. And then again, just like we have with your agency information, we have the same for our program information and your program listing. So this doesn't have to match what your agency listing is. This is for your program and your service. And so Here it's going to ask about your referral and intake information and also your hours of operation. There will be a check mark on your side of things that you can select if you are 24/7. So we know that some services are 24/7, whereas your agency might not be available 24/7. So a good example is like a sheltering program or like our rescue mission or something like that, or like a shelter, a domestic violence shelter, that their services might be open 24/7, but your intake's not going to be, or your administrative hours aren't going to be. So you can be very specific here that your hours of operation, you select those again, the Sunday through Saturday, with your opening and closing times, with an option to comment about anything that maybe is different that you can't just include with just a simple open and close time. So on this one, for example, we have Wednesdays closed for general walk-ins, seen by appointment only, 8:45 to 5 p.m., and then close lunch daily from 1 to 2 p.m. So that's just an example of a note that you could have among your just hours of operation. Up here, you're gonna indicate if a consumer, so if someone seeking your services can just go in, can they self-refer? And it's a yes or a no. And then if a service provider can refer directly, again, a yes or a no. And then accessing services, this kind of describes what your intake time and that process looks like. So for service access, this listing said expect to be contacted within 24 hours. And the intake process just says phone and walk-ins. An example might be, phone appointments only, walk-ins, expect 30 minutes for intake, anything to describe your intake process. But again, we're asking you to be clear and we're asking you to be concise when you do any of your commenting. And then the additional information on your program listing, your business type dropdown is going to be populated for what you put on your agency listing. Your listing number will then become assigned to you, so you don't have to worry about that. It's going to ask you to indicate if your facility is wheelchair accessible, if it's equipped with elevators, is it accessible to public transportation, meaning does your public transit, if you have it, not everyone has public transportation, but is it accessible from where you're accessing, where a person is accessing your services? And then do you provide transportation to or from your service? So after creating or editing, you're going to click that save and complete. And again, if you're updating your listing, you're going to do reviewed, no changes. And then to cancel anything that you just did, you're going to hit cancel. And so now I'm going to show you what a listing looks like from the back side. Oh, did I switch over? That was more seamless than usual.
Yeah, we're good. We're on the update your agency page.
Okay, great. So it's the same page that we just showed you with your information. And then any program listings that you have. So this is your agency information that when you're doing an update, we do want you to review this each time. But your program listings are then going to show down here. And let's go to the one I'm pretty sure you already saw. And so you're just going to double click to highlight your programs. And then you're going to review your listing. And that's going to show you each part that you had. So when you're adding a program, this is already going to be up there when you do add new program. But since this already existed, this is how you would get to it to update. So the screens look similar. Again, we went over this. The information is the same. To plus it, to expand the sections, to edit the sections are here. So if we look at it, because I think this was the most detailed one, You'll see where you can select all that applies. You'll see this long list, you might have to write it down, of where you can add your services. So this is the one that covered most of Southwest Virginia. You'll see where you can add your age ranges, other eligibility criteria, includes gender requirements, income, residential, or other items. So again, if it doesn't apply, we encourage you to leave it blank. You'll see the languages that you can select, and then those accommodations that you can select, your document requirements that you can select, and then cost of service, availability, and then the additional information. So you'll see here where the business type pulled from it, and then you'll see your listing number. So right here is the Council of Community listing number, and then with the AB is the program listing number. And so that will be issued to you directly. You can see that our facility is partially, you'll have the option partially. So it's no, yes, fully, and yes, partially, and then not applicable. So not applicable would obviously be if you have a virtual site or something like that. But this one is yes, partially, because we have a downstairs and an upstairs, but we don't have an elevator. So we indicated no on that. We are in downtown Roanoke, so we do have access to public transportation, but we do not provide transportation to services. So that would be where you go to do that full program listing on the back end. This is what your site's going to look like. If you are updating and there's no changes, you're going to say review no changes. If you've made changes, you're going to do save and complete. And then cancel if what you did, you don't want anything to save. And you'll also have an option to print your listing to review on your own. But then after every time that you're editing out your section, you do want to hit the save. So for this purpose, I'm going to hit cancel because I'm not making any changes for it. And then it will go back to the regular, where you see my agency information and you see all of our program listings. So we'll go back to where we were. We're back on the PowerPoint. Great. And I think I just said this whole slide. So this is where you see all your program listings, and then double click it, select what you want to do. And then when you're adding your new programs, everything we just went over now, you're going to repeat for each program listing. So add new listing, add new listing, add new listing, just as we did this one. So some helpful reminders: all listings, new or edits, are reviewed and approved by our 211 Virginia database curators. It can take 2 to 4 weeks to complete the review, depending on your number of listings depending on the number of listings currently up for review. Again, we have over 17,000 listings, but they all don't go up for review at the same time. Initial approval for new agencies can take slightly longer than existing agencies, because again, they're assigning keywords, they're reviewing that full listing, so that makes sense. Changes are not going to appear on our public side, our searchable database, until approved, so just be patient. And your database curator or your community engagement specialist may be in contact for clarification if there's unclear or conflicting information, if we maybe feel this could be a separate program listing, if we need more information, if something doesn't look right, we'll just keep in touch with you. Now, I really buried the lead on this one because I do think we are an online database. It's easy to kind of update and take control of your listings and manage your listings. So we do want you and encourage you to kind of do this on your own. But we are here for support. You can have one-on-one, kind of like this, support from a community engagement specialist or a database curator. If they're near you, they might come into your office and can offer support too, but you are not alone in this. I know it can seem overwhelming. And then if technology is not your thing, but you want to be in the database, we can give you a paper form option. So you can see where I really buried that. So you wouldn't give up on the process before learning about it. But we do have paper forms that you can complete, but it's the same exact information. You're just doing it on your PDF or on your own if you print it out. Okay. How are we doing? Do we have any questions? Do we feel okay? Overwhelmed? Are we good? Okay. We got the get added part over with, and that is the biggest part of getting listed with 211 Virginia. So now you're listed. Let's just pretend like you're listed, or maybe you already are listed in our database. Now we're going to go to get updated. And get updated is exactly what we've already done. So there's really not much to tell you other than follow the same kind of processes, except you're going to be editing and reviewing instead of adding. So to get updated, you're going to do the same thing. You're going to go to 211virginia.org. You're going to select the you're going to select update and add your agency. This information is going to pop up again, except you're not going to go to add your agency. Instead, you're going to log in with that ID and password that you created. But if you're like me and you didn't create one, you're going to have that verification pop up when you search by your agency number. And so your agency number is that number that it was given to you that starts with 4 letters and then has some numbers after it. So that is your agency number that you can also search. So annually, each agency listed in the 211 Virginia database needs to review and update listings. So that is kind of a minimum when it comes to being listed in our database, is that we do send you an annual update, and that is a requirement. One thing that is really, really hard, and if anyone else tries to kind of recreate their own information and referral system or has their own kind of databases, it is really hard because as soon as you print something, it can become out of date. So it's really important for us that our agencies are up to date, our program listings are up to date. So at minimum, we want you to visit this once a year, and that is a requirement to being listed in our database. So to get logged in, so these are options for updating. We have already touched on, but as a reminder, if you create that password or use your agency number, it does provide a data trail. If you have an ID or a password, you can recover those. And then worst case scenario, if someone leaves that held the passwords or you completely forgot your passwords, login, whatever, you can create new logins and passwords with a new email address. You're always going to have to check that you're an authorized person. And this is all going to go through our database team as well. But 211 Virginia staff do not have the ability to reset your passwords. So if you forget your password, it's up to you to recover it. If you don't have any means to recover, then you will have to create a new login. We don't have any of that information within our system. I did see how you check if you're an authorized person. So you are authorizing that you are an authorized person. If something looks weird on the back end or in a listing, or we think maybe someone did something they weren't supposed to, our database team will catch that. And so there is really no list to make sure you're authorized. I think it's best practice for probably, along with your administrative listing, which is your executive director, to also have another person that's kind of in charge of doing your annual updates if it's not going to be your executive director. So sometimes you can attach different people to each program listing as the program contact or the intake contact, but I think best practice is probably to dedicate one other person, or that could be crazy if you have a bunch of program listings, but a few people that are authorized to go in and update your agencies. So there is no way to check if you're an authorized person. You're the one that kind of self-subscribes to be an authorized person. Thank you for that question. And then for logging in with your agency number is going to be included in all requests to update your agency. So any communications that you receive from our database, they're going to include your agency number. The agency number can also be found on 211virginia.org in your search results, and I'll show you that side of things in a little bit. That method is also used to set up a new login. You're going to see that same verification pop up where you authorize yourself. You can create, and you'll also have an option to create an ID or password, and of course, verify that you're not a robot. So basically, you can have your own logins. You can fill out that authorization kind of verification form each time, or you can do it with your agency number. This says pop-up blockers must be turned off because it is a pop-up. So if you do have kind of hard securities on your system, you may have to turn them off just for the login site. It hasn't been an issue for me, but that doesn't mean that your pop-ups might be blocked. So for your agency number, how do you search it? So on the main page, the 211virginia.org, you're going to enter your zip code and the name of your agency and click go. From there, a list of all programs listed associated with the agency should come up. The agency number is going to be that 4-letter region designated followed by a 4 to 5 digit number. So this is the Council of Community Services, and we're SWIR, SWIR 0345. And I think that's for Southwest Information and Referral, but you'll have those 4 letters starting with 4 to 5 digits afterwards. So for agencies with a need for confidentiality, program listings can be marked as private, and they're not going to be listed in our public searches. If that's something you need, we ask you to get in contact with our database curator for confidential program listings. Most of the time, those might not be confidential, but they also might not need to be live all the time as well. And we'll talk about that when we talk about alerts and temporary changes. We'll highlight that. But if there's a case where you have a program listing where you don't disclose your address, you can just put it as your main address. And then obviously when someone calls you for intake or is accepted into your program, then you would disclose that information. I think of like domestic violence shelters, human trafficking shelters, and things like that, where there is need for confidentiality that you might not list all your information on the public side. So when you're updated, we won't go over this too much because I think you're pros from our previous section, but when you're getting updated, you must review your agency information. So that's all of this information when it comes to your addresses, your phone numbers, your website, and your administrative or your agency contact, your executive director, and just making sure all of this is still accurate and current once you're updating. So once you're done, you're going to click save. If no edits are needed, you're going to click reviewed, no changes. And then you're going to do the same for your programs where you select them. I think you're pros at this by now though. So you just select them and then you go to review listing. You do one at a time, review listing, and go through that same process where you can expand and edit or just review the changes. Yep. So, and then it will be the same slide where you review no changes or save and complete or cancel it out completely if you didn't mean to. But when it comes to updating, if you update it and you don't have any changes, we do want you to do reviewed no changes. And that's going to notify our team that the listing's been reviewed and it is current. And again, we like to note that it can take 2 to 4 weeks before you see anything live on the website. I had demo, but I think that unless you guys want me to show you, it's the same thing we've been seeing. So I think we will probably be okay with that. What I just showed you was the same demo. And then for temporary changes and alerts, I think this is just important to note because we know that sometimes you may have something come up or just a temporary change that does not affect your entire program listing. Maybe you ran out of funds for the month. Maybe you have a wait list enacted, but you don't want to change your program listing. You're just having a temporary change in service. And so when that happens, we ask that you communicate that with our database, our community engagement specialist, and we have the ability to actually just put an alert on your listing instead of you having to change a listing that is just going to be temporary. So an alert is a temporary non-seasonal change to a program listing that may last for a specific date. So that can range from 1 day to 6 months, including restrictions or additions to program listings. And so we like to think if it's beyond 6 months, and this kind of goes to a lot of our agencies right now as we are in like year 3 of COVID, that a lot of people, at what point is it actually an operation change and you need to change your listing? And so we've had a lot of alerts kind of last longer than those 6 months through COVID. But if you've transitioned your services completely online, or you're only doing online intake or appointments and are no longer opening your doors that way, then we might need to look at program revision, that listing revision rather than an alert. That is kind of what we were dealing with for the last 2.5 years, but alerts are definitely really handy and do help us keep that information up to date. It helps us keep our community resource specialists giving the best referrals, so we're not overloading you. We know right now housing and utility assistance is a huge need, and sometimes our agency's funding is out before they can get through their wait list. So we just want to know that information and keep in that constant kind of communication. One thing about alerts is that we can make those real time. You don't have to have that 2 to 4 week waiting time. We can go in and push that to live. They're initial and dated by community engagement specialists or database curators. So we know when's the last time that alert has been reviewed. We know if we need to review it, if we need to look at it, if we need to change it or follow up with the agency. And we review those on a monthly basis just to make sure they're current. And then I think I've already touched on this, but just to note that emergency listings will be activated when appropriate and are not going to appear on the public search until live. So a good example of that with emergency listings, if a disaster happens and like a Red Cross might offer sheltering, they're not doing that year round. They might just be offering it for that disaster. Or a city or county is doing something that we would activate that listing. So those are emergency listings that are temporary that can be pushed to live when appropriate, but aren't going to sit on our database live kind of searchable side if they're not. Okay, so I'm going to show you the front end now of a listing. I think I'll start, let's see. Can you guys see the transportation listing?
Sure can.
All right. So this is an example. I'm not going to show you this full listing, but this is an example of an alert. So the town, is it a town? This is Mary. This is your area of Winchester.
Yeah, Winchester is an independent city.
Okay, independent city. The independent city of Winchester received a grant, and they are offering free fares through June 30th, 2023. So that's awesome that their transit system has that. That is an alert right now. That's a change in service. And so the alert description on the public facing side is going to go right here on the listing. And for a full listing, nope, that's the back end still. So I'll show you a full listing of what it looks like on our end. So this is the listing that we were looking at a good bit during all of this. Oh, I might have too many tabs open on my 2-1-1. Let's see. If that doesn't load, we can just look at Winchester. I think that's fine. So you'll see where the full listing goes on the public side of the website. You'll see the name. You'll see it's a program of the agency, Winchester Transit System. And you'll see that the addresses, the mailing addresses, the program keywords, all their phone numbers, their website, email, their administrative hours, their intake contact, what they do, who they serve, how much it costs. Though right now the alert lets us know it's free, the cost of it. And then this is actually around the program listing service. So when the service is available, additional comments around that, and then where we indicated where the service is provided, if it's ADA compliant, the business type, and their last update. I don't know if that one's loaded yet. That's okay. But that's a good example of a full listing and alert description. And so on the home side of things, this is where if I wanted to look at my listing and my listing number, I could do the 24016 and I could look up the Council of Community Services, click go, and then you would see all of our listings. And so when you look at, when you're trying to identify your agency number, you can see right here, there's our SWIR, SWIR 0345. And then you can see it pulled all of our listings. So that's how you can search your own agencies. And then this is database 101, not the public side of things, but you can also just search by your resource categories. You can open those up, select those each way as well to find you. And then once you click on a category, you can put the zip, that is a lot of zip code, your zip code, county, statewide, to find resources, you hit go, and then it takes you, well, affordable housing. Well, we all know about that. Let's try another one. That might be too specific in our area. Let's try homeless prevention instead of affordable housing. Okay, so then you'll see where it pulls the zip code, anything related to that keyword and what's nearby. But we can do another session around that. But I do think it's important to know how others are going to navigate to find your information once you're listed in the database too. So lastly, we invite you to connect with us. And one of the ways to know who your regional kind of community engagement specialist is by those 4 listing numbers or letters. So with SWIR, the Southwest Information Referral, that's going to be your Southwest engagement person, which is me. And then our Southeast Virginia, which is Siva, is Brittany Boyd. So if you're in that region or your listing starts with that. Richmond is Nelson Diaz. Right now we have a vacancy in Northern Virginia, so you're welcome to contact me if you need anything. And then Mary Monaco in our Northwest region, and then Tabitha North in our Central region, and she is housed with the United Way of Central Virginia with our database team. So our database team consists of our Director of Community Impact at United Way, Joan Phelps, our database curator, Kenita Withers, and Sheila Archer, all within the United Way of Central Virginia. So our teams work together, but this is really the team behind the full database. And then Robert Morrow, our statewide director. And so ways to connect with us are to sign up for our newsletter, to follow the Council of Community Services at CCS Roanoke on Facebook, Instagram, Twitter, and LinkedIn. And then also we do invite you to go to 211 Virginia University. That is really a resource page for our agencies. And we are looking to revamp that with our Thursday session tomorrow. So if you're not already in that one, we encourage you to be a part of that and learn about a little more about how you can get engaged beyond the listing with 211 Virginia. And for those that like a regional map, here's kind of how we are regionally spread out when it comes to our different community engagement specialists. And so sometimes your listing number, you could have multiple places throughout the state. So you're welcome to connect with whoever's closest to you as well when it comes to community engagement. And I think that was so much information. I think we did it in an hour and a half-ish. I think the people who have stayed with us, I know it was a lot of information and hopefully good information. And again, this is the 101. So if you need like a 400 course, it's not going to be me. It's going to be our database team, which I am happy to connect you with. But I think this is a good overview of just how to get started, get listed, and then just make the most out of your listing. So thank you. If we have any questions, feel free to unmute yourself or put them in the chat. I will email the slides to our attendees. I saw that in the chat. And then we, through 211 Virginia University, will host other informational sessions that you're welcome to join us. And you can find more on our social media and newsletters when we're offering those as well. But if there's no other questions, we can adjourn and just encourage you to register for Thursday and Friday and celebrate Saturday with us. And just thank you for spending your afternoon with 211 Virginia. Thank you, everyone.